If we go ahead and we remove the patellar ligament, we can see better what is happening between the femur and the tibia bones. And we can see that between the lateral condyle of the femur that's articulating with the lateral condyle of the tibia, we have a disc. And we also have a disc between the medial condyle of the femur that's articulating with the medial condyle of the tibia. These two discs are made of fibrocartilage, and they are articular discs because they are in the articulation between the femur and the tibia. And these two articular discs are what we call meniscus. We have the lateral meniscus and the medial meniscus. And both the lateral meniscus and the medial meniscus are very important. When we look at our knee in motion, we can see that the lateral meniscus and the medial meniscus have this adaptive deformation. And that is very important because the lateral meniscus and the medial meniscus provide padding between the femur and the tibia bones. They also help to fill up the gap that there is between the condyles of the femur and the tibia that are articulating. So overall, the lateral meniscus and the medial meniscus, they have this very important function of providing congruence between the articular surfaces of the femur and tibia bones. Now, if we look again at this video, we can see that we have a ligament that is basically going from the anterior aspect of the femur towards the posterior aspect of the tibia, and we have another ligament that goes from the posterior aspect of the femur towards the anterior aspect of the tibia. And these ligaments, they cross each other, and that's why they are called cruciate ligaments. And depending if they attach in the anterior part of the tibia or the posterior part of the tibia, we name them anterior or posterior cruciate ligament. So this ligament that we see here that is going from the posterior part of the femur and attached in the anterior part of the tibia is what we call anterior cruciate ligament. And the ligament that we see that's going from the anterior part of the femur basically and runs all the way to grab the posterior part of the tibia is what we call posterior cruciate ligament. Remember, they are named anterior or posterior according to the part of the tibia that they are attaching to. Now, if you have a cord that goes from the posterior part of the femur and crosses over to grab the anterior part of the tibia, what would you expect this cord to do? This cord will specifically prevent the tibia from moving too far forward in relationship to the femur. And if you have a cord that goes from the anterior part of the femur and grabs the posterior part of the tibia, what would you expect this cord to do? This cord will prevent the tibia from moving too far backward in relationship to the femur, because the cord is going from the anterior part of the femur, crossing over to grab the posterior part of the tibia. And those are the functions of the ACL, anterior cruciate ligament, and the PCL, posterior cruciate ligament. Now, we can really value the function of our posterior cruciate ligament every time we are walking downhill or we are going downstairs. Because every time we are going downhill or walking downstairs, the femur has this tendency of going forward in relationship to the tibia. And the tibia bone doesn't go all the way backward because of this PCL that is holding them. And with that in mind, you can conclude that the PCL needs to be very strong. And in fact, the PCL is the stronger ligament. And that's why when we hear that someone had a knee injury, we hear that that happened at the ACL because the ACL is not as strong as the PCL. So usually the ACL is the one that gets stretched or torn.